Hello, everyone. I'm Garrett Thomas, and today I have the pleasure of speaking with Dr. Doug Terry, a board-certified clinical neuropsychologist. Doug Terry is an assistant professor at the Department of Neurological Surgery at Vanderbilt School of Medicine, and he is also the co-director of the Vanderbilt Sports Concussion Center and the director of the Center for Cognitive Neurosurgical Studies. Dr. Terry will be speaking at the upcoming SNS Symposium, giving a talk titled Atypical Concussion Presentations and Treatment Recommendations, Functional, Neurological, and Somatic Disorders. Dr. Terry, thanks for being willing to speak with me today.
Garrett, always great to see you. Thanks for having me.
Yeah, so to get started here, if you could just give me a brief overview of your upcoming talk and sort of, what you plan to present on here at SNS.
Sure. This is a talk I'm really excited about, and I think it has a lot of clinical relevance. As neuropsychologists who specialize in sports concussion, we know what to do with the prototypical patient, but there are some, different patients that walk through the door with more unique or atypical presentations. So this talk is really focused on those individuals who might walk in with what seems like a stuttering disorder or a motor disorder that is aphysiologic, as in doesn't make sense with what we know about balance or gait following a concussion. Or some individuals have a high sense of somatization, or even, more things in the functional neurological disorder spectrum. So what we hope to do, or what I hope to do that Saturday morning of SNS is review the evidence of what we know about these patients, what the prognostic factors in their recovery might look like, and how best to treat these patients, as well as communicate with them.
Yeah, well, it sounds like really important work. And like you said, the typical presentations, we kind of know what to do with that, but there is still a significant proportion of people, who don't fit that typical mold. And I'm curious, based on your research or experience, what percentage of people would you say sort of fall into that atypical presentation sort of box?
Yeah, it's a great question. And I don't know if any study has ever truly examined that. These are typically more rare presentations. And, in a review, in prepping for this talk, reviewing the world's literature on this topic is a variety of case series, especially as we think more about functional neurological symptoms that don't seem to be medically explainable in that regard. So I don't know if we have an idea of the prevalence. Now, somatization is something that's become, a focus of recent research, although we tend, at least many of my colleagues, tend not to use the term somatic symptom disorder. So I think that's a really interesting thing where we understand the importance of anxiety or thinking about your symptoms and attributing your symptoms to concussion, when in fact they might be because of other factors, or they might just be because we're all natural human beings that experience symptoms. So we understand somatization a bit more, but I still don't know if there's kind of a threshold where we can come out with a prevalence even. I would say that this is a relatively understudied specialty population.
Yeah, well, it's really important that you're doing work in this area, and again, it can be hard to disentangle anxiety symptoms or these other features from concussion, but again, really, really important to better understand people sort of at that individual level. And again, it seems like really, really important work that you're doing.
Yeah, and I think that, these are things that we deal with as clinicians all the time, and we just might not put the verbiage like somatic symptom disorder or functional neurological disorder to them. But I think it's a really common presentation to work with an individual who's had several past concussions, but then they perceive that they get a new concussion every time their mom hits a speed bump or a pothole in the road, or if a car stops a bit too short and they feel their head jerk. I've heard, anecdotal comments of it feels like my brain is sloshing around, or it feels like my brain is hitting the inside of my skull. Now, biomechanistically, we have pretty good confidence that those instances are likely not a new concussion. But how do we communicate and explain those things to a patient? And is there, a DSM-based diagnosis that helps them understand why that they might be experiencing these symptoms and communicates to other providers who might be better able to engage in empirically supported treatments when we put a diagnosis of something like somatic symptom disorder in that sense?
Yeah, well, it seems like education in that sense is so important in psychoeducation, and won't jump too far into talking about the recommendations. Want to save something for the talk, but overall, thinking about big take-home message there, what are you hoping that neuropsychologists and other providers can gain from this talk?
Yeah, I think that many of us feel like we're alone, especially if it's something that's rare that we haven't seen before. And I certainly have never been to a talk on this topic. So I think that one, it'll be really important to see who else has seen this, and what's out there, trying to review the evidence. So I want practitioners to walk away with the notion that they're not alone. Others have likely seen this unique presentation, and some concrete recommendations as to what their next steps should be.
Well, Dr. Terry, this has been wonderful. I know that I'm personally really, really excited to join this talk at SNS and really looking forward to the upcoming symposium. So hope to see you all there in Philadelphia this May. Those of you who are listening, you can read more about the conference and register to attend on the SNS website, which is at sportsneuropsychologysociety.com. You can also follow SNS on Facebook and Twitter. Dr. Terry, thank you again. Always a pleasure.
Thanks, Garrett. Catch you soon. And
See
looking
you
forward
soon.
to seeing everybody in May.